Seen them as well, guys. So that's something that's very important, guys. And one of the things I like to tell students, the cranial nerve is very important, guys, to understand. It is telling us something. Like when we're doing an assessment, guys, when we're doing the patient's head, that we're looking at the patient's head, looking at the hair, is it brittle, is it dry? That's probably the patient is dehydrated or the patient has spots or alopecia. You see that everything that we're looking for in our patients is telling us something, okay? So that's very important to understand, and I tell you guys that you gotta recognize and know what is the objective and subjective. Anybody know what's is subjective and what is subjective? Anybody?
Subjective is from the patient.
Who's talking to me? Oh,
Subjective is from the patient. Objective is your assessment.
okay, and when we talk about the assessment, guys, I like to tell the students that the, what did you say, Emily?
I said, what do you mean what I said?
Repeat it.
Oh, I said subjective is from the patient. Objective is your assessment.
I like to tell the students, guys, that the objective things are something that is measurable. Let's say you say the patient has a, excuse me, the patient has a laceration, okay, in the abdomen that measures 5 centimeters and have 8 sutures. Is that something that is measurable? So the patient says, I got a stomach pain in the wound. And then you're gonna ask them, remember we talked about that last week. From a scale of 0 to 10, can you please describe what's your pain? Well, I got an 8, okay? So we gotta remember, guys, we're gonna be inquiring PQRST, right? Okay, who could talk to me what is a PQRST?
Like the level of evaluating pain.
Huh?
The level, how to evaluate pain.
Mm-hmm.
Herniation, palliation.
What is
quality.
exacerbated, what alleviates it, does it radiate, guys, for the
Severity.
quality of the pain? And obviously, we're gonna say from 0 to 10, guys. Okay, we don't use the wake 'em back, that's for kids, remember? We talked about that, that's for the kids' pain assessment guide. So that's very important, so that's something that we gotta understand. And what the patient tells you is exactly what he or she tells you, yes or yes? And we quote it. We do not change the wording, guys. We write exactly what they say. My belly hurts. Because you don't expect the patient to talk to you like you do. There's gonna be people that doesn't know how to talk like you do. You are educated, guys. And we're gonna be encountering patients that are not educated as you are. And one of the things we gotta remember, guys, we're gonna see our patient as a what, guys?
Oh.
I love that response. I'm gonna put it here, because you better remember that, okay? So who was the first one to say whole? Courtney. You stated that you're looking at the patient as a whole. What that includes?
Body, mind, spirit.
I'm adding some more. Because sometimes these aspects are affecting this, guys, okay? Yes or yes? And this one right here is affecting this as well. Because let me tell you something, a person that is depressed, what does that patient do?
Not eat.
Huh?
Sometimes they don't eat. They don't eat, take care of themselves.
They don't do anything, they don't care for themselves, and they don't eat. So you see that it affects nutritional status. So we're incorporating all these things, guys. We're gonna be able to target our patient. Okay, and the Joint Commission tells us to see the patient as C or JC. Okay, not that I'm talking about religion, I'm talking about JC, I refer to JC, the Joint Commission. Okay? Understanding? So if you give your heart to JC, guys, you will be an excellent nurse. Yes or yes? Meaning that if you follow everything the Joint Commission tells us to do, we're gonna be good. Yeah. I got somebody that's steady, he's not gonna do that. He's gonna do what he thinks so it's the most best example for his patients. No. That's the only time I say no. It's either yes or yes. Yes, sir. Don't go to the booth. Okay, good. Okay. So that's that, and later on I'll talk about this, guys. I'll give you example of these things, so that way we could. But first of all, what I'm gonna do is this one right here, cranial nerve. Just to answer one of my students' question, he says, "What are we doing today?"
We're doing the cranial nerve.
There you go. And I'm gonna cover my mouth and nose, but you're gonna uncover yourself. Okay? Because I need to touch you. Okay? With your permission, is that okay? Okay? So you got already the cranial nerve paperwork, guys. I gave it to you. It's not that hard. Okay? I'm gonna tell you tips and bits. And we're gonna see later on. When you do the reading, you're gonna see that makes sense. Okay? Okay. So, Mr. Andrew, my name is Mr. Rivera. I'll be your nurse today. Watching my hands. Okay. Is there any cultural consideration I need to be aware of? Me being a male and you being a male, I'll be touching you and performing some examination on your face and touching you. Okay? Patient agrees, stated no. I washed my hands before I started. No cultural consideration. Excuse me. I'm just preparing my kit, guys, okay? I'm gonna ask you a variety of questions. Please respond to your best ability, okay? We could use adjustments of words and things like that. If you don't know how to say it medically, just go with what you know, okay? What I'm doing right here is doing what, guys? Assessing what, guys? My patient is what? Cultural knowledge, yes or yes? Okay. Okay, the first thing I'm gonna do. Does it what? What's that do? Okay. Okay. The first thing I'm gonna do, Mr. Andrew, I'm gonna have you close your eyes, look straight at me, okay? I need you to cover one of your nostrils. I'm gonna place something near to you and you're gonna identify what do you smell, please. Please do not open your eyes. Don't cheat on me, okay? If it gets overwhelming, just let me know and I'll remove it, okay? Tell me what you smell right now.
Coffee.
Okay, good job. Cover the other side. Keep your eyes closed. Please indicate to me and tell me what you smell.
Nail polish.
Say it again.
Nail alcohol. Nail polish.
There you go. Alcohol. I'm gonna give you a 1 there because you first stated nail polish. You can remove your fingers, okay? So you got 1 out of 2, okay? So you stated nail polish is actually alcohol, okay? So what I'm gonna do, guys, and for purposes of your testing, guys, we're gonna see how far the patient could see. And each number indicates how far the patient could distinguish. We're gonna do the same thing with both hands, okay? I'm gonna give this little eye blocker, like I call it. Find it. There was one there. There's none right there. Now, give me a second. Okay, they're not here. But what I'm gonna do is something else. I'm gonna do an adjustment, because as a nurse, I could do adjustment to address my patients, okay? Okay. So the patient did the olfactory test already. I'm gonna have to do the cranial nerve 2, which is the optic. So with Andrew, what I'm gonna be doing is I'm gonna be holding this like approximately like 14 to 12 inches away from you. I need you to close one of your eyes, okay? And then I need you to read the numbers to the level of the most final one that you could read. Please tell me the last two numbers. Like right here says 20/70, please say that right there, okay? The lowest one you
20
can
over
read.
20.
Yeah, read everything right there.
20 over 20, 20 over 25, 20 over 30, 20 over 40, 20 over 50, 20 over 70, 20 over 100, 20 over 200, 20 over 400.
So that one in this line, which one is it?
4, 9, 3.
No, right here. What's the one you're gonna repeat? After you repeat all of these, you tell me which the last number is this one. Okay? That's the last one I wanna tell you. Let's go again.
4, 2, 6, 7, 3, 2.
You could do like this.
Up, no, this way, up, down, 0, 0x, 3, 1 plus, 20, 20.
You read the smallest one? He hasn't. He don't need no glasses. I can't even see that. So one of the things I'm gonna do, guys, for purposes of documentation, in his left eye, he has a 20/20, meaning that he could read in 20 of distance, guys. His eyesight's gonna be 20. He's good. He don't need no glasses. Don't ask me and don't do it to me, cause I'll be blind. I can't even see it. That's just how I see this one, guys. The second line. Let's go. This is the left. Let's go to the right, Drew. Okay. Gonna show you as well. Please choose the smallest one. Okay. Don't over strain your eyesight. Okay. I'm gonna keep it like around 14 to 12 inches. That's more or less that.
4, 2, 6, 7, 3, 9. This way. Down, 0, 0x, 3, 1 plus, 20, 20.
You got 20/20 in both eyes? Shut the front door. I shouldn't even do you. He got perfect eyesight, guys. Don't feel bad, because I use glasses, but I don't use it here. Okay? So just to let you know. So we did the eyes. We do the segment. Okay. Okay.
So you document the left and right side for the eyes.
Yes, we
and
put the L and the
nose.
right. Yes,
Okay.
that's correct. That's good. So what we're gonna do now? What's his name? Oh my God, I lost his name.
Andrew.
Oh, Andrew. Sorry, Andrew. Sorry. Andrew, I'm gonna stand behind you. You're gonna look straight ahead. Okay, I'm gonna be approximating my fingers. Okay? And you're gonna be telling me what you see in what hand you see it, and you're gonna tell me what are they doing, okay? We're looking for oculomotor, guys, okay? 3, 4, and 6 together, okay? So that's what it's gonna do. I mean, I'm sorry, that one is together with the optic, so correct.
We're still doing the optic?
Yeah, we still do the optic, because you're gonna see the W, just straight looking, okay? When you see my hands and you tell me where is it, okay? What you see,
This.
okay? What you see?
This.
Shouldn't abuse you. You're too good. Are you healthy? I can see that. Okay, so I did the optic nerve, guys. Cranial nerve too. So what we do this. We did the Snellen test, and we did the peripheral vision, guys. You could do whatever you want, guys. You could do like this, flashing your fingers as you go together. You could do them both at a time. I like to do it, but then he has, as we noticed, guys. When we did his optic, he was 20/20, which is good vision. Okay, so we're gonna go to the oculomotor. I'm gonna be getting close to my patient. I'm going to put my mask back on. Okay. What I need to do now, I'm going to be testing Mr. Drew. Okay, he's cranial nerve 3, 4, and 6. There are 3 things that we're going to be testing together. Okay. So please look straight to my nose. Don't move it. Okay, I dim the light. I'm going to cover one of my patient's eye. Okay. Okay. Going to approximate my headlight. He has a 3 mm, guys. Okay, millimeters.
That's the size of.
That's the size. That's what you need to the size of it.
That's the size of the pupil.
Yeah, that's okay. If you have this one, or this one, or this one, you're not normal. But like I said, you're normal. You got everything good up to now. So that's very important. Okay. What I need you to do is stare at me, Mr. Andrew. Open your eyes. There you go. He has good movement of his eyelids. Close it. Close them. Open. There you go. I'm going to state that my patient's pupils are equal, round, reactive to light in accommodation. Okay. And I'm going to do what we call, guys, is doing other things. Okay. Together. Okay. Oh, I need you to look. Follow my fingers. Look down. Don't move your head, Mr. Andrew. Look down. Look up. Side. It's gonna be Buckeye at the end of this thing. There you go. Good job. He's doing that. Okay. Okay. He has down and inward movement, and I need you to do this, Mr. Drew.
Cool.
I can see you. You could do it. Drew. You can? Okay.
Wait, what are you doing?
He's looking inside. Okay, so we're gonna go to the trochlear, okay? We did that one already, cranial nerve 4. He did the movement to the side, to the left, down and up, okay? We did the lateral eyes, and I'm gonna use the 6 cardinal field with my pen light. Mr. Andrew, please stare at my pen light, okay? Don't move your neck and your head, just please move your eyelids, please. I know you're gonna be tempted to wanna do it, okay? So we're gonna stop right here, stare at it, okay? Keep it right there. We're going to the right, going up, gonna go down, gonna go up, gonna go down to the middle, gonna go to the right side, gonna go down, gonna go up, gonna go back down. I'm gonna go to the middle. Keep staring right there, Mr. Drew. Okay. You did it now, Drew. You did this. Okay, so you didn't do it before, but you did it now. So he did it, guys, okay? He did the 6 cardinal gaze, which is basically like 10, he's talking, and I could see him right there. Look, what you doing right there? What you chewing? Okay, he hasn't gum and he didn't give me. I see him mastication, guys. This is trigeminal, guys, okay? Okay? What I'm gonna do with Drew, you're gonna go against resistance with your permission. I'm gonna touch you, okay? I'll be touching your face, okay? I'm gonna push up. Open your mouth. Open your mouth. Okay. Was it hard a little bit?
You said I was supposed to go against it. You said give you resistance, or?
No, I'm pushing it up and you're gonna try to open your mouth. Okay, okay, good job. That's very important to know. So I already got this right here, okay? I'm gonna have you close your eyes, Mr. Drew. You're gonna feel something sharp and something dull, okay, or soft, okay? When you see and you feel it, just indicate me with your permission. I'm gonna stab you with something, okay? It's not gonna be painful, okay? So you let me know where you feel it and what kind of pain you're perceiving, okay?
So you want me to touch it where you feel?
No, I'm doing. You're gonna say in my left side of my face, I feel something dull or something soft. Okay, got it? So I'm gonna start with your permission. Like I said, I'm gonna be stabbing you with something. You let me know when you feel it.
Something sharp above my eyebrow.
What side?
Left side.
Okay. Keep your eyes closed, please. Tell me.
Something sharp on my right cheek.
That's correct. So I'm gonna go with the other one.
Something soft on my lip.
Where?
On my lip.
Where?
Are you lip?
Lower lip.
Lower lip.
Okay, good. And how about now?
Something soft on my nose.
Okay, there you go. So guys, you open your eyes, Mr. Drew. So now I did what, guys? I did sensation using a cotton swab and brush against the cheek, the forehead, the jaws, okay? And we determined what was sharp and dull. He passed the test. You see how fast, easy it is? So now we're gonna perform the cranial 7 facial nerve. You can open your eyes, Mr. Drew, stare at me, smile at me, puff your cheek, okay? Raise your brows, okay? Put them back down, frown. Like if you were pissed off at me. You can't get pissed off at nobody. I'm gonna say that his expression though, anyhow, it looks symmetrical. Because he can't do that. He doesn't, it's against his religion to be showing any type of anger. We can talk about that later on, okay? But you pass your test, okay? So he did that, okay? So he does, okay? His expressions appear symmetrical. I see that his mouth is smiling. That's it. I like to over-exaggerate, guys. See, he does like this. What does indicating that your patient has what, guys? A stroke, something going on. Does it make sense? So he is smiling symmetrically, okay? His eyebrows are both going up, not like this, okay? Then we're gonna go to cranial nerve 8. I'm gonna go behind you, Mr. Drew, and I'm gonna do something, okay? I want you to keep yourself staring. I'm gonna do some noise, and then you're gonna be telling me what are you hearing, okay? So I'm gonna stand behind him. Okay, please close your eyes for me. When you hear noise, raise your hand up the side that you hear the noise from your ear. What did you hear?
1, 2, 3. Like that?
Yes. Guys, he did the acoustic very well. He did the acoustic test. Now I'm gonna have to stand up for me. Okay. Okay. Stand up straight, look straight to the thing. Close your eyes. Don't cheat on me, don't open it. Why are you laughing? Okay, you can open your eyes.
That's it?
Wait, yeah, you can sit. This is called the Romberg test, guys. If he was having problem with his nerve, guys, specifically this one, guys, the vestibulocochlear, guys, okay, he would not have good balance. He would do like this, guys. He would do like this.
When he closes his eyes.
Yep. So that's something we gotta be aware. So I just know he's cheating on me. Don't lie to me, Drew.
No, I'm not cheating.
He was in nursing school. He knew I was trying to slap him because he laughed. I was doing like this and I saw him laugh. So that's that. Let's go to cranial nerve 9, guys. The glossopharyngeal and the cranial nerve 10, the vagus, okay? I saw him talking already, yes or yes? So that one I'm gonna cross out, okay? So what I need you to do, Mr. Drew, is do this. Like if you're swallowing. There you go, he swallows good, okay? I'm gonna take this, I'm not gonna do it over exaggerated. I'm gonna do it to myself, I'm gonna do it to you, make him believe. Open your mouth, please. I'm gonna touch his mouth, he's gonna do, because I'm touching his tongue at the back part, guys. Is activating, guys, what you call that, guys?
Gag
The
reflex.
gag reflex. Okay?
And the swallowing, you wouldn't physically give him anything, it would just be swallowing their own.
Yeah, you could give him water if
spit
you
or
want to.
saliva.
You got stomach ache? Okay. So what I'm gonna say to have you do is you're gonna open your mouth, you're gonna say, ah. I see that his uvula is midline. okay? And his palate is symmetrical. I don't see no edema on his what you call those glands right here, guys? No.
Tonsils?
Huh?
Tonsils?
No. I'll just test you guys. His tonsils are okay. There's no white spots. What is that supposed to be?
Strep.
Strep. He has nothing of that. Yeah. And then I could see that he has his trach midline. Yes, sir. Good job. You're doing okay, Mr. Drew. Okay. So I'm gonna touch you again, Mr. Andrew. Okay, with your permission. He's agreeing with me. Okay. I'm gonna be testing for cranial nerve 11. This one is called spinal accessory. This is where he's gonna shrug his shoulder against resistance. I'm gonna be putting my hands behind him. Okay, I'm gonna be putting it down, and then he's gonna do. Okay? Does it make sense? You shouldn't be having pain unless you're a gym rat and you're having pain and you did shoulders and. Wait a minute, I haven't done strength on you. Count to 3, Mr. Drew. 1, 2, 3. I'm gonna push. Tell me. He has good strength, guys. Okay. So the other thing I'm gonna be doing is what, guys? Says it right there. What I'm gonna do with you?
Push cheek against his ass.
Okay. I'm gonna put my hands right here. I'm gonna be touching you, Drew. Okay. I count to 3. Not yet. 1, 2, 3. Push. He has good strength right there. I'm gonna go to the other one. Drew. Give me a second. 1, 2, 3. There you go. He got good strength in both. So he has his cranial nerve number 11 intact, okay? We got the cranial nerve 12, guys. This one is called the hypoglossal, okay? I already spoke about the midline of the trach, guys. What we need to know in this one, guys, with the hypoglossal, you're gonna pull out your tongue, I'm sorry. Andrew, We're gonna move the tongue side to side and up and down. Okay, so that's the termination of the cranial nerve, guys. He did everything. His cranial nerve are intact. That's how you're gonna be documenting, with the exception as that he has problem in his right side of his nostril. He didn't identify alcohol. He said it was acetone, right, guys? But I'm gonna give it to you. You said it correctly, okay? He had a 20/20 in right and left, guys. This is part of our documentation. All cranial nerve are intact, meaning that he's okay. He's young, guys. If this was a 70-year-old, guys, you think so that's gonna be like that? I don't think so. Fist pump. Wash my hands. Good job. Thank you for being true. But later on, I'm gonna pull you back.
Okay.
Okay?